Good morning, viewers. This is National Orientation in the River State, Nigeria. Welcome to the first edition of NOA River State Dialogue, a live streaming program on Facebook. On this platform every Friday, 11 a.m. to 11:30 a.m. As part of our mandate, we bring discussions that inform, educate, and sensitize citizens on government policies, programs, and activities. And we also entertain feedback in form of comments, questions, and suggestions from our viewers. My name is Ellis Uriadaba, your host. Remember, this program is brought to you live by the National Orientation Agency, River State, with support from UNICEF. Last week, Friday, on this program, we discussed the importance of proper nutrition to the growth and development of a child, emphasizing exclusive breastfeeding for newborn babies. We also talked on the impact of COVID-19 pandemic on child nutrition and government effort at enhancing and improving child nutrition. Today on this program, in continuation of our program on risk communication and community engagement, we are looking at COVID-19 and the challenge of infant mortality. With me in the studio, I have two ladies. On my left, I have a public health practitioner in River State, Madam Lovina Aminatu. Madam, you are welcome to this program.
Thank you very much.
On my right, I have the Assistant Community Orientation and Mobilization Officer for Opoponkoro Local Government Area of River State, Ntebian Ego. Madam, you're welcome.
Good morning and thanks for having me today.
You can be part of this program by sending your comments, questions, and suggestions as the program progresses. Madam Amina, I'll start with you. For the purpose of our viewers, our audience, to flow with us in our discussion, can you please tell us what infant mortality is? When we talk about infant mortality, what is it?
Well, infant mortality has been a major public health problem. Well, talk about infant mortality as I explained is death of a child born to occurring between the ages of 1 day to 11 months, that is 0 to 11 months. And this has been a major problem, like I said, in Nigeria and the public health concern.
Okay, you have had it. Infant mortality is death that occurs between 0 to 11 months. That is before the first birthday of the child.
Yes.
And there is this report by UNICEF that Nigeria has one of the highest infant mortality rates in the world. What do you make of this assessment? And what are the leading causes of infant mortality? Because UNICEF said that in Nigeria, about 39 we have about 39 per 1,000 live deaths. And this is very alarming. So what do you say about it and what are the leading causes?
Well, actually, when we talk about infant death in Nigeria, it's alarming, as we know, because one, there is lack of access to health care. Another thing, there is no sufficient skilled health workers as to take care of these mothers. Then there is lack of abject poverty within the country. That's another contributing factor. Then lack of education. Mortality is high. One, outside modern equipment, poverty. Then another thing that causes low birth size. When you have a baby that is the birth size is too small, that baby will not survive, and that is as a result of lack of poverty. When the mothers are not feeling well, what do you expect of a pregnant woman who is not feeling well? What they are interested in just looking at the children, and the government is not doing much. The mother, sometimes underage mother, You see small children, because of lack of education, lack of information, they are engaged early in marriage. And when you find a small girl who's under 20 years having a child and that baby mother is malnourished, what do you expect from the child coming? That child will not survive. The baby is not, the mother is not healthy, the baby is not healthy. All this contribute to one of the leading causes of infant mortality in Nigeria.
Do you have anything to add? We talk about, we said the infant mortality rate in Nigeria is high, according to UNICEF. Do you have anything to add? What are the causes?
Yes, thank you for this opportunity. Madam has said it all, but I just want to throw more light on what she has said. The causes of this infant mortality is enormous, but I want to narrow it down to just 2 points. 2 points, that's poverty, and then the mentality of the people. I work with the rural people, and from time to time we get to interact with them to find out the causes of all of this. And most times, don't even know what infant mortality is all about. So, as an orientation officer in the LGA, precisely in the Koko local government, we take time to educate these women on the dangers of this infant mortality. So, having said that, if we do all of this from time to time or most often, we can see that the women will, as a matter of fact, and as a matter of consciousness, will come to their consciousness that infant mortality is deadly, and then they will try to improve on their hygiene, first of all, and then their own lifestyle. Thank you.
Okay. And let me come to you again. Sometime last year, precisely in February, Nigeria had the index case of coronavirus. Since then, we've been battling with coronavirus. There were several lockdowns, and at the time, they announced that the country has entered into recession. So how, in your own opinion, how has COVID complicated the challenge of infant mortality? How has it complicated?
The upsurge of this coronavirus have done a lot of harm to Nigeria from the terms of infant mortality, in the sense that, one, when the COVID comes, because of the severity of COVID around, people don't go out. Now we don't go out to make. Initially, everybody within the country felt it was a big man sickness, and even when you say don't go out, they force themselves to go out. They also, in the crowd, they mix the crowd, they do the things they are doing, but government have to force for them to stop it. It has affected us greatly in the sense that one, it is a country suffering poverty. We are already suffering poverty, and now we are not going out to look for food. Poverty setting, how do we get food? The palliative the government started giving, federal government and state government started giving, we are not enough for the people. It was just something that cannot feed one person, to talk of family of 10. In our country, we don't, anyhow we preach family planning, people are not taking up family planning, so they believe that God has said to multiply, and they multiply children that we cannot take care of. So the rate of death became so much because of this COVID. Medical, they cannot access medical services when you are not going out. There's some fear of COVID make people not access the medical facility, because they say if they go to hospital, they will be held down and say they have COVID.
Yeah.
So for fear of that, people hide. Even when they are dying, they say no, they will be well. Some cultural belief not allow them. How will you go out by this time? And they take that, they think you will die. Then some, let us pray. Some say, if I pray, God will do it for me. So many things involved. And because of this, the infant mortality rate became so high. There's this a lot of people cohabit the young ones. They often arrive there in the house. They don't have nothing to do, but when it comes to the other way, they are doing their thing, and pregnancy is not protected. The children are just coming that they cannot take care of. So it affected our country so much. Is it when we talk of how to get food, it's a problem. How do you go to market to buy food? How do you go to even farm? All of this will affect the development of the country as well as infant mortality rates, because how do you feed the children? I mean, it's not just taking children, they have to feed the children.
And feed them well.
Well, yeah. So there's problem of nutrition which affect these infants severely and their mothers.
So what you are saying is that with the COVID, there was another increase
yes.
in the infant mortality.
Yes.
So, viewers, you can be part of this program, send in your comments. At the point in this program, we'll look at your comments, and if there are questions, we'll also ask our guests here to help us answer the questions. Then, our assistant, Kumo, you have been on this job for some time now. And you know that the main function of National Orientation Agency is to pass information to the people, relevant government information to the people. So what have you done? When I mean you, I mean your agency in Okopo, what have you done to see a drastic reduction in infant mortality in your local government? What have you done? From what Mrs. Amina said, there has been an increase with the COVID. UNICEF says Nigeria is one of the countries that has the highest infant mortality. Now with the COVID, it's like the whole thing is complicated. We have more. What have you done in your local government?
Thank you very much once again. I want to start by saying, before the COVID-19 came into existence, proper existence in Nigeria, and River State in particular, the agency in Okoko had gone ahead, even before we were asked to go into the field. We had gone ahead to talking to opinion leaders, talking to mothers, talking to children, students, and all of that. So in Okoko, we from time to time have advocacy visits to traditional rulers, opinion leaders. Most especially, we go hand in hand with the women. We meet women groups, we meet the market women, and then tell them the do's and don'ts for this infant mortality. And if I want to tell you the truth, most of these women have not in their lifetime known or heard what infant mortality is all about. So it's always a privilege. They are always excited to hear from National Orientation Agency when it comes to the local government areas. So they give us rapt attention, and then we get feedbacks from them on a certain topic we discuss with them. And on this infant mortality, a lot of women, even after the program, still come back to National Orientation Agency, asking us, okay, what you said at this point wasn't clear to me. Please, could you further explain yourself? And then by so doing, they will put all those information they have gathered into practice. And at the end of the day, we'll come out with a better proposal. Thank you.
Thank you very much. Let us go to our platform to get some comments from there. So many people are watching us. From Chinwe Opara, he says, parents, especially mothers, must be nutritional and health conscious to avoid maternal pregnancy complications, preterm birth, and low birth weight, as these are major factors that lead to infant mortality. I think, Madam, you have said something like that.
Yes.
He said parents should avoid it. Jumbo is also watching us, and he said in the comments, can an infected mother with COVID transmit the virus to her unborn baby? Somebody is asking, yes, Jumbo, whether an infected mother can infected mother, somebody is infected with COVID-19, whether she can transmit it to her baby,
Yes.
unborn baby.
Yes.
Okay.
It's very possible. Well, you see, the mother that is nursing this baby can infect in the sense that one, the mother is breastfeeding the baby. When she cough, the baby is taking because the baby is not protected by any means. And look at this mother is not also healthy. So we don't expect the baby. A mother is breastfeeding the child, this infant, who is not healthy, her immune system is very poor. What do you expect of the child? So that increases another, so the baby might not even survive.
Okay, maybe infected.
Yes.
From Ify among GSA, he said with the second wave of COVID-19 pandemic, what measures are being put in place to ensure that pregnant mothers access adequate health care? No, we try to say something about it, that with this COVID-19, you said it, that some parents, some mothers are afraid to go to the hospital. Being infected. So what is government doing? That's what she's asking.
Government is
to encourage them.
There's a lot of advocacy going on, education, information, jingles in radios, television, to educate the people about prevention of COVID, how to take care of COVID. One, now, here's the question again. It's like
the question.
How
can they access with this?
Okay, how to access? They are afraid to go to hospital.
They are afraid.
No, we will try. That is why they have a lot of health education in television, jail, marketplaces.
Okay.
They try to do it. The health workers are not resting.
Okay.
Even when you go to hospital,
okay,
they encourage you that no, that coming to hospital is not a death sentence. Access your health care. That you are COVID or that because you come to hospital doesn't mean that you are COVID positive. And so you are free to access your health care. When they check you and they see any symptoms of COVID, you will be treated. So you are just free to access.
Madam, tell you, you are a rural woman. Woman from the village. So for the women, pregnant women, how do you encourage them? That's the question I asked by one of our viewers.
Yes.
Because most of them are afraid to go to the hospital. What do you do?
Yes, most of them are quite afraid to go to the hospital. But let me take myself as a case study. When I meet with such women, all I do is encourage. If by the time you speak to a woman once and leave her, and then you just ask her to go to the hospital on her own, without any, maybe she doesn't have money to go, it could be security reasons, you can now try to encourage her that it's not a death sentence.
Okay.
But if you tell somebody it's not a death sentence, I mean, you still need an encouragement on that person. Because nobody will believe you that it's not a death sentence, especially those coming from the rural areas. You need to talk and talk and talk.
There's some of them are saying that it's not real.
Yes, a lot of them have said it's not real. But until it happens to somebody you are close to, until it happens to somebody who is very close to you, you might not really know the implication of what
you say something.
Yes. Well, let me make an input to what you have said. You see, if you encourage someone, it's not just encourage. Even in the communities, I would say when you encourage them, also follow up. Because sometimes you encourage them as you turn back, they go there and don't mind them. They are using it to make money.
Okay.
That's one thing they are talking about COVID. Say the big people are using COVID to make money.
Which is not true.
True. And they want to use us like guinea pig. So don't go to hospital. Not realizing that it is their step they are implicated, because the more you stay there in pregnancy, how do you take care of yourself?
Yes. You have had it all. COVID-19 is not a scam. It's real.
Yes.
It's real. And it's not a death sentence. So, if you're a pregnant woman, make sure that you attend your antenatal.
Also for the born babies, please make sure you take up your immunization, immunize your babies while you are pregnant. Also go for your immunization, follow up your immunization of the baby so that, and give them, breastfeed them for complete 6 months. exclusive breastfeeding, because what you the mother take is what you are giving back to your child.
Right.
And if the mother is not healthy, how will the baby be healthy?
All right. Let's take more comments from Rosemary Abehat. Say the challenge of infant mortality is enormous, and we can reduce it by preventing birth defects and also ensure that pregnant mothers should register for antenatal care early to reduce infant mortality. We have talked about that. Mr. Jimmy Richard Halliday, you have identified pregnancy of the underage as one of the causes of infant mortality. What can be done to change that? You said you have identified underage pregnancy as one of the causes of infant mortality when younger people do as one of the causes. So what are you doing as health practitioner? What are you doing about it?
So what we are doing about it is parents, like some communities, let me say more in the northern areas, they believe that for a girl child is not supposed to go to school, only just to stay in the house and marry. There was a video recently I had a girl of 10 years married to a 65-year-old man, and this child in the next 2 days will be pregnant. What do you expect? This child, her pelvic is not big enough to deliver that child normally. So she will enter into so many complications. So she cannot easily survive to take care of the born child too. So that's another major problem of infant mortality. So we encourage people, we can educate them how to discourage parents from sending their children to early marriage. So we encourage them for education. I also advocate for the government to stop early marriage.
Okay, let's take another comment. There are so many comments that we can't take all. Let me take one from Benito Williams. Safe medication, the ban of child mortality in the rural areas. Health officials and other related agencies should educate and sensitize them on outcome of the ugly trade. Government should monitor. His own opinion is the government should monitor health care units at the rural areas and enforce discipline. So let's go back to, we'll come back to the, if we have time, we'll come back to the comments column. But before we have tried to, in our discussion, we have tried to mention some solutions to this high infant mortality in Nigeria. Yeah. But particularly, what are health officials doing?
What officials? Thank you.
To help solve the problem, what are they specifically doing?
They are doing a lot of things.
Yes, what are some of them?
Now, some of the things they are doing: health education. They go to communities, educate them how not so.
The question again, I said, health officials, you have told us many solutions about how this infant mortality can be solved. What specifically health officials, practitioners, what can they do? Okay, give us some of them.
Now, apart from remaining in the health facilities alone, they go to communities.
Okay.
In the churches, will give health education using jingles, radio, television to educate them importance of taking care of their health, what they eat, nutrition aspects. You see, one thing and one most important is that when you're educated, at least educated person is different from someone who's totally not educated, how they attend to their health issues. Yes.
Like
this cultural belief that some of them, how can a pregnant person, they believe in massaging, also we discourage them totally. Allow the pregnancy to go, eat well, register for antenatal, very, very important.
Okay.
From early pregnancy, at least it's good for you to register early. Some of them will wait till late pregnancy, 8 months, 7 months, when they already have complications before. So we discourage them from all of this. We speak to them about their nutritional health, their hygiene, how to maintain personal hygiene. Because if you live in an environment, environmental hygiene, and you don't maintain the environment, all of this will cause problem, health challenge. and a pregnant woman.
We'll come to that. We'll come to that. Orientation officer, what do you think? Because what I've asked you some of these questions is that we are at the village, the very small communities, cross small borders. What do you think parents should do to reduce this infant mortality? Parents, when I mean parents, husbands, not just when I say parents, people think it's only women. When I mean parents, the man and the woman, what do you think?
Okay, thank you once again. My first thought on that should be that every family should bring up a child or number of children they can cater for. In the rural areas, we find a household. When I talk of a household, an adult man who is up to the age of, getting married and all of that. But in most of those communities, you find out that a man, a full-fledged man, will have a wife and will decide to have like 5, 7, 10 children at the same time in this era. That's an error.
Under one roof.
Under one roof. That's a very big error. So we try to encourage parents, please, 2, 3 children are okay. I'm not speaking for all of them. They might say, okay, it's God who gives, but then let's try to be realistic. 2, 3 children are okay. So that you can have time for these children. Give them the best of education. And then, if you go back to the religious angle, the pastors in the churches will tell you, it is God that gives. Let them deliver as many as they can. But you are also damaging that woman. Okay. You're damaging that family. So maybe you, the pastor, you just have 1 or 2. You can cater for those 2. And maybe your congregation can also give a boost.
So you're talking about we should have family planning?
Yes, family planning is the key.
Yes, family planning is the key. So, madam, let me, we are running out of time. Let me ask you this question. You talk about hygiene. And you see that poor access to water, sanitation, and hygiene, what we call WASH, it remains a major challenge in Nigeria. We don't have good water.
At all.
Sanitation is bad. So our hygiene is also bad. So they significantly cause diarrhea-related sickness.
Yes.
And you see that diarrhea and malaria is they are major killers of our children when we talk about infant mortality.
Yes.
How do we solve this problem? Briefly, our time is up. Just 1 minute.
How we solve this problem? You see, it's not easy to solve this problem of
just under 1 minute because I have seen this that our time is up.
In the communities, how do we control it? Okay. Now, in the urban, these things can be controlled a bit. But in the rural people, when we talk of the people in Nigeria, we should face the people in the rural community. They are the people that are the main people of our concern. Okay. They don't have good water. Some take water from running streams. How good? Now, when you did some borehole for them,
what should the government do?
Government should, one, go to the community and improve their water by stopping boreholes for them. Yes. Okay. And to stop this going to stream to take water.
And open education.
Open education should be entirely cancelled and build toilet, this normal water system.
And people should have good
water, hygiene. Yes, you teach them, the community, how to maintain good personal and environmental hygiene.
Thank you very much. I have signals from my producer that our time is up. I know that you have so many things to say.
Just an input to what you talk about.
Okay, just briefly.
Now, in family planning, that is where I mentioned. Now we say children by choice and not by chance. Yes. See, as human beings, according to Jesus Keren, as I said, animals, we are all mammals. But human beings are the high animals who have children that when they deliver children, you don't just leave them to go their way. You nurse them till their age. But other animals, as they were so, that is why we advocate for children by choice and not by chance. How can you have 10 children under one roof? And how do you survive it? You cannot survive. they are living abject poverty, the children and fathers sickness, this communicable disease, all sorts of infection.
Madam, thank you very much. Our time is up. Our time is up. You know, time is not our friend. Anytime. We have to go now. I want to thank you very much for your presence in our studio. And I want to believe that if we invite you again, you will come. Thank you. Our invitation is thank you very much. Thank you. It's been a wonderful time with all of you and the viewers. This program will continue next week, same time, same platform, with another interesting topic. To be part of this program, go to Facebook, search for NOA Rivers State, and when you find it, just click on the like button and you'll be streaming live with us. Always keep in touch with us. And remember, COVID-19 is real, and the second wave is more dangerous than the first one. Stay safe and take responsibility for your health and for the safety of your loved ones and children. Obey all COVID-19 preventive protocols. Remember, this program is brought to you live by National Orientation Agency, Rivers State, with support from UNICEF. Bye for now. See you next week.
Thank you, madam.
Thank you.
Bye.